So in the previous interview, the ladies opened with asking about their experience about MS nurses. Now, some of us are quite experienced and we've had to interact with quite a few. And obviously you are an MS specialist nurse. So I know what one is and you know what one is, but do you think you could give us an explanation of what an MS nurse actually is and what your responsibilities are for us?
Yeah, absolutely. So an MS nurse is a specialist nurse that has knowledge around MS and can link in with the consultants that you're under as well. So a kind of a link in between the MS nurse, the patient and the consultant. It's to help with any symptom management, advice on medication that may come from the consultant. So, for example, with disease modifying therapies, consultants will discuss them with a patient in clinic, and the letter then come to us as well, so that we've got more time to then further discuss this with patients in clinic. So that's an important thing as well. Assessing for relapse or flare up, as I briefly discussed before. The assessments around that, whether it's a flare up of residual symptoms or whether that be a new relapse that we need to look into. So trained on, the assessment of that and support and guidance throughout. So, if you're struggling and having a difficult time, it's always good to link in with your MS nurse as we support you the best way we can.
I suppose it's all about having a good relationship, isn't it? I think it's making sure that you're on the same page with your MS nurse. Yeah. It's quite fortunate if you can find somebody that you land with. And I guess it's not everyone's got the same has the same benefit of having such a pool of MS nurses around them. But do you think that that's something that you kind of value from the other side of it, in that kind of patient relationship?
Absolutely. It's difficult if people don't want to engage or struggle to engage, because you get to know somebody as a person, so if they're having going through a rough patch, and sometimes you can pick up on it just as much as the patient is. And I think because you've had that relationship of regular clinic appointments, telephone contact, if there's been an issue and a new symptom, it's a lot easier for us to assess in that regard.
Zoe mentioned that sometimes she struggles with knowing when to contact her MS nurse. So I know the answer isn't for everything, because you guys are really busy, but are there any scenarios where you wish that a patient had made contact sooner than waiting for the consultation? And do you think there's a line somewhere?
Yeah, absolutely. I think the most important thing is if people think that they're having a new symptom or a symptom flare up and they're unsure between the difference of these, it's always good to ring so that we can do an assessment. So if you come into clinic and saying I had a new symptom 4 months ago, but that's gone, we wasn't able to assess you at the time of that symptom, so it makes things a little bit more difficult. So, for example, ringing up with a new symptom, explaining how long it's been there for. If you've had any recent infection, we would like people to ring and just explain what's been going on. If they've had anything recent infection that could be causing new symptoms or flare up of symptoms, anything particularly stressful, to understand when we do an assessment over the phone that it can be quite difficult with fatigue setting in with the amount of questions that we need to ask. But it's really important that we ask all these questions so that we can see if we need to see you in a relapse clinic or whether or not it's something that we just need to monitor further.
So I noticed in the previous interview that there were some techniques that were kind of being discussed about how to get the most of meeting up with your MS nurse. There's been some things about obviously providing as much information as possible. But Gemma said that she needed to be quite firm with her MS nurse because she wanted to make sure that she was getting the outcome that she was hoping for. So are there anything that you've seen in your experience that doesn't work when a patient's trying to interact with you on those kind of levels, and the kind of behaviours that you wish that you were able to see less of?
It's hard because everybody's a completely different person, and the personality is completely different. So again, it's very individual to how people are. I think the main thing to put across is just, you know, we can't sort out absolutely everything in one appointment, but what we would do is, where I was discussing before about putting down what's the most important thing, because making too much change in one go isn't always the most effective way of doing things. But having an action plan, so for example, you wanted to be referred to a physiotherapist, and that was the main thing in that appointment, then we would put that in place, and then a further action plan, so something both maybe at the next clinic appointment or a follow-up call as well, because sometimes we offer telephone clinic appointments as well, which are beneficial.
I always get surprised when I interact with MS nurses. And I think even the last time I saw you, you really surprised me when I said I was having a problem with the outside of my hand. And you were going on about which part of the nerve, where the nerve damage would have taken place. And I think I've seen that in a few occasions where you go, wow, those MS nurses really know what they're talking about, and they really have a proper understanding of what's going on. You think it's all going to be the neurologist, but you know, you guys really do have a lot of experience to give in these situations.
Yeah, and I think it's really important that, you know, in clinics that people come and they're honest with the symptoms that they're having. Sometimes that may be an embarrassing symptom for them that they feel that they don't want to discuss. But again, everything's so important to discuss that we can go through. And sometimes it's just as simple as putting somebody's mind at rest that they've been worrying about something that they may have thought was a new symptom, but it's a flare up of their residual symptoms. And I think, you know, bringing down the stress levels and things like that is really important via discussion.